We're thankful that the governor's here, Senator Neal, Norton Healthcare, and we look forward to working together. Without further ado, it's my pleasure to introduce to you the Governor of the Commonwealth of Kentucky, the Honorable Andy Beshear. Governor.
Thank you. Well, good afternoon, everyone.
Good afternoon.
I'm honored to be here with you at the NAACP headquarters in Louisville to highlight an important initiative in our quickly expanding COVID-19 vaccination program. For weeks now, I've been saying our main issue with these safe and effective COVID-19 vaccines, because they are safe and effective, that our main issue is supply, supply, and supply. That remains true even as we build out our infrastructure, now opening over 410 vaccination sites across the Commonwealth. Today, we are here to prioritize making sure that these vaccines reach all Kentuckians. To do so effectively, we must address vaccine hesitancy. We acknowledge that there are deep historical causes of vaccine hesitancy amongst Black Kentuckians that must be faced squarely. They must be acknowledged and they must be addressed. The pandemic didn't create inequities in our society. Those inequities have built up over decades, over hundreds of years, but this pandemic has laid them bare in so many raw and difficult ways. Now, I know that this is a pain and a legacy that I can never truly understand, that I can never truly feel. But I promise to listen, I will work to hear, and then with good advice and good counsel, we will act in a manner that promotes fairness and equity. As Dr. King reminds us, the time is always right to do what's right. What's right for the Commonwealth is we build a better Kentucky where this shot of hope is available to everyone, regardless of your socioeconomic status, regardless of your skin color, that this vaccine is available to everyone. I am pleased to be working alongside the NAACP in Louisville and all of you who are here today to address these issues, to lead, to show people that it's safe, and to try to work to make sure we can address any hesitancy that would keep someone from getting this life-saving shot of hope. My administration has been listening, and we've been working to take action. Beginning last year, we started holding community listening sessions with more than 60 community leaders across the state, representing community groups that might have been hesitant to take the vaccine, including Black, Latinx, and rural communities. What we have heard in our outreach is that people want to see and hear from people trusted and respected in their own communities, that they want to hear those voices saying that this is a safe vaccine, and they want to see those leaders, people they already put their trust in and have fought beside, to take this vaccine in a real show that it is safe and effective. Recently, we joined 60 faith leaders at the Capitol. There's a lot of praying in the Capitol that day, as they received their first vaccine and then helped amplify the message in front of their congregations and in their communities. And we know that we need to make sure that people are ready and willing to get the vaccine, which means bringing it to where they are. So in addition to the 410 locations across the state, we've been working with partners like the University of Kentucky in Lexington, as well as Norton Healthcare in Louisville. Norton is administering the vaccines today, but not just today. They are helping to increase availability in Louisville's West End with a clinic at the YMCA on West Broadway. But they're also partnering with our administration to launch clinics at St. Stephen Baptist Church, Bates Memorial Baptist Church, Quinn Chapel AME Church, and New Covenant Baptist Church, and we are just getting started. And what we have heard at each of what we call those pop-up clinics is that it is a safe place where people are excited to get the vaccine and look around and see those they know and trust getting it at the same time. In addition, Walgreens and Kroger offer vaccination shots in the area, along with the federally qualified health clinic. We also know that barriers to transportation can be harmful. So we're working with partners to take Kentuckians to vaccination sites. Yesterday, we announced public transit agencies across the Commonwealth are offering free or reduced cost transportation to and from vaccine locations. These services are already open in 100 counties that reach 75% of all Kentuckians. We want all Kentuckians who want to be vaccinated to be able to do so with no barriers, not transportation, not anything else. Kentuckians can find a vaccine and transportation services near them by going to kycovid19.ky.gov for a listing of those participating agencies. For those unable to access the internet, you can make a call at our vaccine hotline, 855-598-2246. When we look at where we are right now, in terms of an equitable rollout of this vaccine, it's not good enough. We have more work to do. But our goal is to be intentional and to admit that we have programmatic, that we have historic, and that we have societal issues and barriers to address. Part of the programmatic issues we're here today to work on and work through. The leaders that we are here today with can speak to the historic barriers that have created the hesitancy and address it head on. But let's not forget the societal barriers that, based on the priority that the CDC set for first healthcare workers and then ultimately educators, meant that our African American communities were underrepresented because they are underrepresented in those fields here in Kentucky. That means we got work to do on the societal level too. And what we are committed to doing here shouldn't end just here. We've been working with you to try to right some of the wrongs that we've seen. Last year we launched the 1-2-3, the healthcare awareness campaign, resulting in tens of thousands of additional Kentuckians getting health care access at the moment they needed it. The Department for Public Health's Office of Health Equity is also engaged in every part of our rollout and will help build on our commitment. Again, I want to thank the leaders that are here today. This is a deadly virus. It has taken far too many of us, and everybody bears some of the scars internally and externally. Most of us have at least lost one person we know and love. Many of us have lost multiple people that we know and love. But there is a bright light at the end of this tunnel. But it's important that we all walk together towards it and nobody gets left behind. That there is no front or back of the line, that everybody moves as one, the way that it's intended. So let me just say thank you. Thank you. We always talk about getting through it together. Now we got to promote this vaccine together. We got to make sure that people are getting it together. And my pledge at this historic moment is to try to get it right. We think about so many other historic moments where maybe we didn't get it right. But if at this moment in time, defeating a 1 in every 100-year pandemic, we can do this the right way, the equitable way, the fair way. And maybe that next thing we face, whatever it is in society or the rest, we can do that the right way too. Thank you all very much.
Senator Neal.
Good afternoon. I'm pleased to join with the NAACP in welcoming our governor to the 33rd Senatorial District. I might point out that this is not unusual for the NAACP, which has provided invaluable leadership throughout the years, and more specifically in this community and the 33rd District. So I congratulate them on continuing to do that fine work. But I also want to congratulate our governor. I want to congratulate our governor because from day one, he has stood up strong in protecting the citizens of Kentucky. And that's meaningful because some people didn't get it, but he got it from the very beginning. He became a national leader in terms of what he's done in this particular regard. He's adapted his actions in such a way that he's responded to threats that we didn't even know was evolving, but as they came forth, he and his administration stood for the Kentucky, the citizens of Kentucky. So I think he's due credit there, because not everyone has stepped up to the plate. And let me point out this as well. For him to come here and demonstrate with his leadership that he understands exactly the historical circumstances, in this instance particularly with African Americans, is meaningful and it's useful, because it's important that all of us get vaccinated, because we are truly in this together. So I'm here to announce that I've had my 2 shots.
All right.
And I want everyone to know, and I'm asking everyone in earshot that join me, join others, join everyone in this quest for us all to defeat this virus. And we can do it if we do it together. Again, I want to thank the governor. I want to thank the NAACP governor. You're always welcome in District 33.
Thank you.
All right. Thank you.
Yep.
I too have had my 2 shots.
Aha,
And got my card
oh,
to
that's
prove
it. That's it.
It's important. This is for real. And in the African American community, we are infected nearly 3 times the rate of white Americans. And we are twice as likely to die from the virus. It's real. The Louisville branch NAACP encourages the entire community to get vaccinated, but especially our constituents. We have to come together to work to defeat and rid our community, our city, our nation, our state of this god-awful virus. We're so pleased to have with us Norton Healthcare. And I'm going to ask the president, Mr. Russ Cox, if he will please come forward and make his remarks. And then I am assuming that he's going to tell us how we're going to vaccinate and the procedure for vaccinating about 8 persons who are with us today to get the vaccination. Thanks so very much.
Thank you.
Come on, Russ.
I'll move out of your way.
Okay, sorry. Thank you.
Welcome, Russ.
Thank you. Thank you very much.
Are you doing the vaccination?
Thank you so much, Mr. Cunningham. Governor Beshear, thank you for being here.
Thank you.
Senator Neal, thank you all so much. Norton Healthcare is very pleased to be here today. This is an issue that is at the top of our priority list of Norton Healthcare. It's at the top of every thought that we have. We must work together. We will work together. What we know for sure is there are 2 things that are barriers right now. There is apprehension. We recognize there's apprehension. We want to help remove that apprehension. But it's not just apprehension, it's access. We need to provide access in the neighborhoods, in the churches, in the communities. We need to remove all technology barriers. We need to make this a simple process and make access real on a daily basis. As Governor Beshear mentioned, we've started that. We have begun the process of having these pop-up clinics. We're going to continue to. We had one yesterday. We have 2 more scheduled for next week, and we'll continue to do that as long as it takes. The governor has been wonderful at getting as much supply as he can to all the healthcare providers. We're going to continue to work together. We're encouraged by what the future looks like, but we all have to work together to make sure that we provide the access that is necessary. Thank you very much for allowing us to be here today. We will be providing vaccines in this room in the back here. When everything is finished here, we will need to do it in a very safe environment, and we encourage you to get this
Take a couple
vaccination.
questions.
Thank you very much, Mr. Conley.
Thank you. Do you want to introduce some of your team that's here?
I would absolutely love to. Thank you very much for that opportunity. To
That's
my
great.
left is Dr. Kelly McCants. We have just formed over the past 6 months the Norton Healthcare Institute for Health Equity. He is a heart doctor who works predominantly at Norton Audubon Hospital, but is throughout our system. He came forward and said, health equity is an important issue. It's my calling. It's what I want to do. And we have named him executive director. We're still making him be that heart doctor, though, because we absolutely have to get at the #1 cause
Yeah.
of what is killing Black Americans today. That's heart disease. So, Dr. McMasters, thank you
COVID's
very
number
much
3.
for stepping up to that as well.
COVID is now the number
Yeah,
3
Dr.
cause of death.
McMahon, I'm sorry. We also have with us in the back Dr. Flynn, if you'd raise your hand. Dr. Flynn is very much been involved in our vaccination process. We're somewhere now of having vaccinated nearly, how many, Joe?
We've given 70,000 vaccines in total.
70,000 vaccines. So we need to continue to do that as we go. We have with us as well Mr. Riggs Lewis, who helps us with policy. More than anything else, I ask you to give a round of applause to the clinical people who
Yes.
are providing the very service that we're talking about today, who
Yes.
provide the vaccinations, who put those shots in your arms, and they do so very gently. They do so very gently. We have a wonderful group of people who are coming out to the community. Yesterday at New Covenant, we provided vaccinations for 270 people. We had approximately 12 people who raised their hand and said, send me there. That's where I want to go. I want to go where we can make a difference in this community. So thank you very much to all the employees who volunteered to make this a reality. We're only just beginning. This is a process that we're not going to go to sleep on until we have completed it. So thank you very much.
Thank you, Mr. Cox. Thank you for coming to be with us this afternoon. And Ray, would you hold up the fact sheets that we have published for the media and anyone else who is interested in getting them? We have them available. The NAACP, we have with us our health chairman, Dr. Beverly Gaines, which
Yes. Good morning.
we are working in cooperation with the administration, the mayor's office, Norton, and everyone to emphasize the importance, and trying to relate to our community the need to get the vaccination. And after we get the vaccination, the need to practice distancing and to continue to wear the mask. The media, we're glad that you are here. Kind of crowded in here. More than we anticipated and wanted. But we're thankful that you are here, and we will continue to practice distancing. If those who are going to administer the vaccination, and we're going to ask those 10 people or 8 people who are here, our guests of honor, if they will stand, those who are going to receive the vaccination.
All right. Yeah.
Thank you so very much. How do you want to proceed, if you will? Technician.
We have some questions for the governor, if we can.
Okay, thank you.
Yes, sir.
We are,
I almost got away.
Almost.
okay.
Almost.
Governor.
Sure.
I'll begin since I posed that. Governor Bashir,
Sure.
I represent viewers in Northern Kentucky and Cincinnati, and Greater Cincinnati, WLWT. And the question, obviously, a lot of consternation about what happened yesterday at the convention center in Covington.
Right.
I know you talked about it briefly, but There are clearly many people in Cincinnati that scheduled up in good faith, and they
Right.
were turned away, and some told us the National Guard turned them away. Vocally, it seemed like there was a lot of confusion. What do you have to say now
Sure.
that a few hours have passed?
So the National Guard meets everybody in front of that facility. What we were able to work out after learning that Kroger had made a mistake in zip codes that it allowed is people are going to be able to get those vaccinations, and we are going to get reimbursed enough vaccines to make up for that for Kentuckians. Listen, none of us have ever done anything on this level and this size before. And to those that I know it creates a huge amount of anxiety and an outpouring of emotions if you think you're about to get your vaccine and suddenly you can't, but we're going to get them taken care of. We're going to make sure they get that vaccination, even though they're coming across the river, and then we'll make sure we get those extra vaccines for our people. You know, it's unfortunate. I hope it's the only time something like that happens, but with an undertaking this big, we're going to have to ask for people's patience as we continue to build and improve moving forward.
Are you aware, Governor, Ohio does allow people from Northern Kentucky or wherever to go across and get vaccinated? Does this put Kentucky in a bit of a strange spot in the national dialogue about haves and have-nots and how we're handling things?
Oh, I don't think so. So originally, when we had to put our policy in place where we're allocated doses just for our population in Kentucky, and what we had is we had people coming over from Tennessee, which started it that were in a priority group here that they weren't there. And they were saying, sure, but in Kentucky we qualify, and that was going to take away from vaccines here. Supply is going to solve all this. When we have enough supply pouring in all places across America, then sure, we can throw the doors open. But if I get, what do I get right now? 71,000 first dose vaccines a week for Kentuckians. I got to make sure they go to Kentuckians until we have more vaccine.
Governor, you've talked about opening a facility for vaccination in Shawnee Park.
Yes.
Where does that stand?
Okay, so we're still working on it. That is our number one ask of the federal government, is a surge vaccination site, a FEMA-backed vaccination site there. What we've asked for is additional supply. Because right now, if we divide the pie even more from the pop-up clinics we have going from 18th and Broadway and others, then we basically just add another place you can get it, but we reduce the amount that are at the others. It will happen. We're looking at the options of it right now, and I think we can expect in the next, probably month or month and a half, we'll see that become a reality. Our goal right now, though, is to have programs in the community that serve the community. When we open up a large regional site, remember, people can drive from any part of Kentucky or from the city, and right now the way that we're doing these clinics help make sure that since we are committed to equity, that those clinics are serving that equitable purpose.
What difference do you think the Johnson & Johnson single shot
Oh.
vaccine is going to make in your supply?
Johnson & Johnson vaccine is going to be a huge boost that's going to help us ultimately get to herd immunity. First, it is a highly effective, safe vaccine just like the others. All three of them almost eliminate serious illness and death, and that's what we're trying to stop. It's also a single dose vaccine, meaning those that are hard to get to, those who might be homebound, our homeless populations, which need to be protected too. It's going to provide a lot of advantages that Moderna and Pfizer don't. You also reach a level of immunity pretty quickly, because right now, without the booster, you get to their full effectiveness at about 4 weeks. What we've heard from the federal government are two different sets of numbers for how much is already manufactured. One is 2 million. We'd get about 26,000 in the first week, if that's right. Another's 3 to 4 million, so we get 38, 40-something thousand. After that, the supply is going to drop off a little bit because that's the pre-manufactured amount, and then pick back up again. So it'll be a little uneven, but it's a great vaccine. It's going to help us get there faster, and we need people to know that the best vaccine you can get is the one that you can get.
Governor,
Yes?
what's your reaction to the Jefferson County Public Schools reopening plan? And then for you and perhaps Mr. Cunningham, is the plan equitable?
So, we've been vaccinating our teachers at a faster rate than anywhere else in the country. And the goal of that was to come up with a safe way to get our kids back in schools with their instructors as well. I think that requires, again, always continuing discussion on how we reduce the density, how those that are in need of transportation aren't exposed more or put at greater risk than others, and think about what we do when people are coming back. I believe, based on the CDC science that is out there right now, with this vaccination effort, and if we strictly enforce the COVID rules in our schools, that a hybrid model can be safe and will be safe. But you got to earn that trust too. All right, you got to earn that trust. People have to see how it works in schools to build it.
Governor, also, so go please. Yes, sir, go ahead. Sorry. On that question.
It was asked to both of us, right?
I wasn't planning on, I'm not sure how I feel.
Yeah.
I have a lot of respect for the
Sure.
3 members who did not vote to support the plan.
Mm-hmm.
The NAACP has not taken a position on the opening of the schools. We will examine it, look at it, and we'll be glad to offer an opinion once we've had a chance to look at it closer.
Governor,
And
quick question for the members.
if I may, I hope we're all also holding everyone accountable for the way it's done.
Yes.
As it moves forward. I think the difference between a safe school with kids in it and an unsafe isn't whether or not it's open, it's how well those rules and regulations are followed.
Yes.
There continues to be a tremendous amount of frustration about the unemployment system in Kentucky.
Mm-hmm.
In fact, I interviewed a couple of people yesterday. They waited months. They haven't got any money, first off. And they talk about these automated robocalls that come at night, and sort of it's like a mental drain on them. They say you're not forgotten about, but they're not even answering the calls anymore. What do you say to these folks?
Yeah.
When is this system going to be fixed? Will they be made whole?
Well, our challenge that we're facing in the midst of a pandemic is that when times were good, our state did not do its part to hold up and maintain our safety net. If you think about 3 or 4 years ago, when we moved 90-something people out of that and failed to upgrade a system, our IT system is pre-DOS. It was put into place, its coding in the 1970s. We have 3 people who know how to code it, and they've got to do that just to get the numbers out of it, which creates a huge impediment. The new impediment we're dealing with is more fraud than we have ever seen in this area, with tens of thousands of claims being filed by one cyber criminal. And we're working through all that, and we got to make sure that we can stop it, because if you have to look through 8 fraudulent claims before you can get to 2 valid claims, those 2 people have waited too long. We are in the final considerations for awarding a new contract to replace that system. Unfortunately, it's going to take months, if not a little more than a year, to put it in place, but we are committed to helping every single person. Now, we're about to get additional continued unemployment assistance from the federal government, meaning people are going to be able to continue their benefits longer. That's certainly going to be a help to those folks. But to have a system conceived basically in the 70s, to have a office where every regional office was cut, and then to face the unprecedented number of claims we've had, is like being given a car without wheels and being asked to drive the Indy 500. Now, we're not allowed to have excuses, because there are people out there, but we're getting the wheels on the car, we're driving it faster and faster, and we're going to get people their help.
You're confident they'll be made whole, Governor?
I'm confident they will be made whole. I wish I could tell them that they won't have to wait any longer, but as we work through it, I want to make sure I'm honest and transparent with them. If they're entitled to it, however long it takes us, we will get them what they're owed.
One more, Governor.
Sure.
Here in West Louisville, I'd like to know what you think of Senator Neal's and President Stiver's West End Economic Partnership Plan.
Well, let me first get Senator Neal to talk about it, and then I'm happy to talk about
We talked about it extensively, so.
Right, but he's here, and all of you all are too. Come on up, Senator.
Unprecedented opportunity for West Louisville. As you know, those the herd, we're targeting for the first time the area west of Main Street to the river, now Algonquin to the river north, with intentionality in terms of developing the tool. The particular reference tool is the TIP, which is a tax increment finance district, which basically allows, in this instance, tax that's created in excess of the valuations that rise, 80% of it will come back and be focused into that district. That's one aspect of it. The key to this thing is that it's focused on housing for those who are in their houses now, that own those houses, and their heirs. Up to 30 years, we will have a tax freeze on payments. So therefore, as of the valuation of January 2021, so nobody can rush in and upset the apple cart here. So if this legislation passes, we're going to have the ability to have a tool that is very intentional, that's very focused, and is driven by members of the black community. There are two board structures. One is the permanent board. There'll be an initial board which actually fashions how this goes forward in terms of the permanent board. The permanent board will have the ability to make decisions and do these things. So we're not making decisions from where we are. So what's going to happen is it's going to be black led in terms of that board, and there'll be an additional board, an advisory board, which actually comes out of the neighborhoods, which will also evaluate and recommend, etc. So the idea is to get robust participation from the community, in this instance, the targeted community that I described, to drive this, to fashion this, to make sure that they have the focus. Now here's the thing that really strikes me. With the $30 million minimum that we are intending to put into this pot, starting off, we're expecting, quite frankly, hundreds of millions of dollars over the life of this thing, in order to focus. So this is not a shot, no pun intended. This is not just a shot in the arm for just one particular period. This is a tool for building over a period of time. So with intentionality, I think this is big. Now, it's not a panacea. It fits into other things that are happening. For instance, the city government now is focused on refurbishing the infrastructure, rebuilding infrastructure in that part of the town as well as others. There are other types of nonprofits and others that are doing great work in the community. I think what's going to happen here is when they see how effective, if it's done right, it has to be done right, that the expertise is brought to bear, that the community is driving this process, that at the end of the day, this is something they want to make successful as well. I think you're going to see other people investing their intentionality around this and working with it and be even stronger than I'm even stating here. So I'm very excited about it. I'm what they call a cynical optimist. I'm cynical because I know too many times people promise stuff and they don't deliver. And the West End of Louisville knows all about what I'm talking about. But I'm optimistic because there are people with intentionality that are out here, are determined to make a difference, to make a change. And I think this is one tool that will be very significant in how we move forward in West Louisville. Good?
Yeah. Each of my last budgets has included millions of dollars for a fund to help West Louisville and other disadvantaged communities. The concept of $30 million there ready to be invested is exciting. What's more exciting is how it will be done by an organization that is Black-led, by community members investing in the community, and that it's also designed, I think, to create wealth within the community and not simply to try to bring someone in. I agree with the senator that the way it's done once in practice is going to be critical, that investments are made that will work through a TIF system to generate additional revenue that can be invested back into the community. But I'm excited about a real possibility for the type of significant investment that I think we've all wanted to see, and the fact that, again, as opposed to locating something in a community, we can actually lift up the businesses that are already there.
Governor, can you talk quickly about 1C being launched Monday? Because I think all members of the media here, there's probably some eagerness. How on earth can the state verify who's an essential worker, or, I mean, anybody can say they're a member of the media, or any other essential frontline worker? What's going to happen on Monday?
We'll answer that one, and then these guys got to get vaccinated. I don't want to make them wait any longer. Monday, we are moving to 1C at all of our regional vaccination sites. Our local health departments, some of our pharmacies, other groups that can be more targeted are continuing to focus on individuals 70 and older. When we look at the data across the state, what we see are we have reached a significant portion of the 70 and older, but it's going to take additional steps by more targeted groups to reach much of what's remaining. Now, 1C is a big group, and that means people are going to need patience, and people are going to feel frustrated about not being able to get an appointment. That will solve itself as more supply comes in. Now, are we going to try to ask people to produce their employment information? No. But what we're going to ask is for people to do what they have been doing all throughout this pandemic, which is the right thing. We hope to not have to put other things into effect, which at different times we've had to, but I think everybody understands that we've got to get those 60 and up, specifically those with chronic health conditions, and those essential workers that are exposed to COVID more than others in as quickly as we can. Now, supply is increasing every day. The Biden administration has increased us over 70% since they took office, and J&J is about to come out. So again, as supply picks up, I think that we will see a lot of these challenges, but also the anxieties begin to ease. Everybody wants their shot, but we need you to wait your turn. And they have waited their turn. I'll tell you, when I got the opportunity, I'd never been more excited to have a shot in my arm in my life. And so thank y'all for your leadership today, for showing everybody how safe and effective it is, and it doesn't hurt at all.